go back to what you said, David, about the serotonin and the stress. We all agreed that stress was an issue. And then if you look at tryptophan metabolism, tryptophan can go two ways. Tryptophan can go down to serotonin production and then melatonin. So is sleep an issue with her? Going back to history, is she insomniac? Is she fall asleep? And so on. That's an important question. How is she sleeping? She's sleeping poorly, the problem. But stress also depletes tryptophan, and it goes the other way. That goes through the kynurenine pathway. And if that occurs, then we also have a problem. And then that kynurenine pathway is also upregulated through inflammation and pathogens. So if she has inflammation, which we know her CRP is up there, climbing, and if she has pathogens of some sort, and she's under stress, three things, she's depleting her tryptophan. Now, more importantly, is there are studies out there that have looked at stressed pregnant women and having an onset of children, higher incidence of having children with autism. Now, they've also looked at lower serotonin levels in women who have higher risk of autistic kids, and they correlate. Again, how do you do that? But it makes sense. It makes sense.
That's where an organic acid profile would show you quinolinate and kynurenate. You can see if you're lighting up that pathway, and that's why when we intervene, if we're trying to feed the serotonin pathway, we're using a form that's dedicated already into that chute, if you will, where it will not go down through the kynurenate pathway.
Yeah, and most people with a chronic disease of any type have a lower tryptophan levels due to various reasons, which we've talked about.